I'm at the family restaurant today, and I'm going to ask my cousin and my aunt what I thought was going to be a very simple question with a very simple answer. But, you know, it doesn't always work out that way. Welcome to Maharaja India Cuisine, my family restaurant. And today I have a question for some of my family. Let's go over here and take a look. Okay. Auntie, Satesh. This is my cousin Satesh, and this is my auntie Raja Lakshmi. And I have a question for you guys. The question is, are you ready? It's an easy question, auntie. Easy question. When you're okay, so I hate to say this, but in my family we have a history of high blood pressure and diabetes, and auntie and my cousin Satesh both have high blood pressure and diabetes. So today's question. Today's question is about high blood pressure. Okay, so when your blood pressure is high, what is the most common symptom that you have?
You feel dizzy.
Dizzy? When your blood pressure is high? How about you, auntie?
Blood pressure high, dizzy.
Dizzy?
You feel upset.
Anything else?
Yeah, you feel unbalanced too.
Anything else?
Well, you feel
like if your blood pressure goes really high, what do you feel when it's really high?
Really high, your heart beats pretty fast.
No, what do you feel? Do you feel anything?
Lightheaded.
Lightheaded?
Yeah.
Are you sure that's not when your blood sugar goes high?
The blood sugar goes high, you fall asleep. You're a doctor, you didn't even know those parts. Blood sugar goes high, you fall asleep because it knocks you out because the sugar is too high.
All right, okay.
If blood pressure goes high, you're lightheaded and you're dizziness because you need to walk it off.
Okay, so in my clinical practice, most people when I see them, when their blood pressure is really high, the most common symptom is headache. That's what most people say when the blood pressure is sky high.
You do have that.
They say headache. They say headache. But I guess for you and auntie, it's dizziness and lightheadedness, which is on the list.
It's a headache too.
And it's a headache. So headache is included.
But if you bear the headache, then what you feel it.
Okay. So there you have it. The most common symptom, at least in our family, if your blood pressure is high, is dizziness, lightheadedness, and headache. After watching the video that you guys just saw, I started to think, and I realized that as your blood pressure starts to go higher and higher and higher, you'll experience different symptoms. And my cousin and my aunt, it's kind of a small sample size, n equals 2, are two individuals in my family who, as their blood pressure starts to go up, will start to feel dizziness and lightheadedness. Now, I strongly suspect that as their blood pressure continues to climb higher and higher, they will have headaches, and they did kind of confirm that, but I think the headache will get more and more intense the higher and higher the blood pressure goes. In the emergency room, what I typically see is people when their blood pressure is very high. So the systolic is above 200, the diastolic is above 100, so maybe 220 over 120 is what I'll see. And in those situations, they definitely have a headache, plus the lightheadedness and the dizziness and other things. So I think the teaching point for this video is, if you do have high blood pressure and you start to notice these symptoms, get your blood pressure checked. Figure it out. Come to the hospital if you need to. We're there to help.